Health Minister, Dr. Motsoaledi, and provincial officials are expected to host a media briefing at 2 o'clock this afternoon on the challenges in the sector. These include the recruitment of doctors and the implementation of NHI. Let's unpack this story with Russell Rensburg. He's the director at the Rural Health Advocacy Project. Russell, thanks very much indeed for your time this afternoon. And it might be a good time to begin, I think, with some of the victories that the health department can claim. The last time we had a briefing of this nature was a year ago. The aim is to make it an annual event. What's happened in the past year that the health department can actually celebrate?
I think this last year was a year of transition. I think we've continued to see gains in some of the critical areas like infectious diseases. We've made a good recovery in tuberculosis and in HIV post-COVID after some declines. We've made a good recovery in vaccination rates amongst children after decline from COVID. But we've also seen some increasing challenges around the system, particularly at the hospital level. So one of the challenges I think that the minister will have to think about, and the team will have to think about as they recalibrate South Africa's health response, is really focusing on which of the areas we're going to prioritize, because the issues are many. We are generally going in the right direction, but we are taking strain, and we need clear strategic leadership on a number of core priorities to build trust in the system. Because I would say that trust is at a weak point at the current moment.
Yeah, absolutely. The very sort of entry into the system, hospitals, clinics, we know that 84% of the population relies on our hospitals to function, to be able to provide medication at the very least. And are we able to do that at the moment? The answer for many communities is no.
No. Look, I think it's very difficult at the moment. Over the last 3 years, we've had significant funding constraints. A lot of that have been driven by above inflation increases on health worker salaries. The first of those in 2022 were unbudgeted. Mm-hmm. And I think provinces, which are the main deliverer of services at the moment, are struggling with significant accrued expenses as a result of what they call unfunded commitments, where commitments are made, but no funding is allowed at the provincial level. And the last time we checked, and actually it was confirmed in the Minister of Finance budget speech, was an amount of 22 billion rand. So that's like a shortfall before they even start doing their business. The second part is that hospital costs continue to rise. Given that we have a very hospice-centric health system, both public and private, the bulk of our expenses are accrued at the hospital level, where currently up to 60% of the national health budget is spent on large, sometimes inefficient hospitals. And I think we can do a lot better with that. When it comes to district health services, which the president coincidentally prioritized in his State of the Nation, I think while we've made some gains, without investment now, a lot of those gains could be lost. We, for instance, have close to 6 million people on HIV treatment, but we need to have at least 7.2 million on treatment to ensure that we meet our 2030 goals. TB deaths have been declining significantly since 2015, but without the right investment, we could see further rises in TB deaths, which currently account for around 56,000 deaths annually from a curable and preventable disease. And we haven't even begun to look at the impact of non-communicable diseases, particularly cancers and diabetes, which was such a terrible scourge on our country during COVID.
I want to get to the issue of the withdrawal of US funding and the impact on our HIV and TB programs. But I want to just hone in, Russell, if you can give us some clarity on these unfunded commitments. How do we come up with unfunded commitments? What does that mean?
Well, essentially means that we don't have, with the increases that were transferred to, provinces don't raise their own money. The money is allocated through a national budget vote, through something called the provincial equitable share. Now, if you don't include sufficient funding within that equitable share to account for increases, it means that your budget in the end is higher than what is lower than what your expenditure is. So come the end of the financial year, your budgets are overspent. Mm-hmm. So that's what happened in 2022 with the health worker strike, and then the arrangement only being made after the budget was passed. So it was unfunded. When relief came, in October, the funding was only for healthcare and education workers, whereas the province employs a much wider range of workers. So already it had that shortfall. Then subsequent to that, they continued that in the following budget year, which was 2023, 2024, they didn't increase for the entire system again. So they've been carrying these additional HR costs for some time, haven't worked on finding efficiencies, which the Treasury think they could. And the result is that we're now sitting with these major unfunded commitments, meaning that they can't fully fund goods and services like hospital syringes sometimes, medicines, and the like. So that's where it comes. So supplies in the past may have filled that gap, but suppliers are no longer willing to wait more than 120 days for the invoices to be paid. So that's kind of how we get to this point of unfunded commitments.
Sure. The last thing we need is the withdrawal of funding, right? You've talked about the gains we've made in our HIV and AIDS treatment campaigns, in TB deaths. What do you see as the outcome of the withdrawal of USAID and our 2030 goals?
I think the withdrawal of those, we may not feel the impact in the first couple of months, but over time we will. So in the long run, it will result in is an estimated, what they said over the next 10 years, at least an additional 500,000 new infections. And what that means is that we no longer achieve the goal of ending HIV as a public health threat. In fact, there's a risk of more deaths. So we need to find ways to ensure that the support that was provided by the American people somehow gets replaced with national funding, and that is a lot more prioritized so that we can find those populations that they were able to service. Similarly, TB is also reliant, particularly for testing, from overseas development assistance. We currently have a shortfall of funding to meet our target of testing 5 million people this year. So my expectation is that I'd probably expect the minister and his MECs later today to probably announce the prioritization of closing that gap, because it's South Africa's biggest public health threat. The first is obviously getting at least 7 million people on HIV treatment. That's good for everybody. It reduces deaths, it reduces overcrowding in clinics, and it has a direct impact on TB. We're hoping he's going to announce or double down and re-announce the 5 million test campaign for TB, looking to close the gap. Because between those two medical conditions, they contribute to a number of other medical conditions, particularly maternal health and overall life expectancy. So we're hoping that the prioritization for the minister will come from there.
Yeah, thanks for that, Russell. And I think we will be certainly keeping an ear out for that when the minister does address us at 2 o'clock along with his MECs. Are you also hoping to hear more clarity on NHI, just given what the finance minister had to say? Essentially, he said he doesn't know whether the health minister knows where the money for NHI will come from.
Well, I think we also always understood NHI as a restructuring of existing budgets, right? But that process takes some time. Currently, we spend around 275 billion rand on publicly funded healthcare. As I indicated earlier, the spending is a little bit unbalanced, with a large portion going to hospitals and less money going to district health services. So what we would expect over the next 5 years is, as they design the mechanisms for the NHI, they can start focusing on immediate priorities. Those include finding a new funding model for hospitals, where they have a little bit more autonomy and accountability for the money that's allocated for that function, and greater prioritization of district health services, which includes clinics and district hospitals, where 80% of the population access their services. And lastly, we're hoping that with the establishment of the Benefits Advisory Committee over the next few weeks or months, we can begin to see what the base package is that can be available for all South Africans. And I think one of the issues here is like a basic routine healthcare services, particularly for young people. Our population is now closer and closer, more than 50% or close to 50% that are under 35. The kind of services that they need are different. They don't always want to be able to access them in clinics. And I think doing small things like making sexual and reproductive health services available comprehensively, for instance, at Dis-Chem or pharmacies close to where young people work and are, could be a step in the right direction into making healthcare services more affordable. Then Another idea would be to, in the pilots, look at contracting in independent practices that include GPs and the like, and start bringing the routine care closer to the people. And I think that would be one of the major steps that they could achieve with implementing some of the NHI reforms. Where, as for the whole NHI process, I think that process will be multi-generational. And I think the initial priority, as Dave indicated, will be on district services, which is the kind of services I've described. So the NHI is definitely a goal to work towards. But right now we have a very immediate priority to start reorganizing our system to not just get ready for the NHI, but really meet immediate healthcare needs of the population.
I get the sense that the health minister should have spoken to you and the Rural Health Advocacy Project to try and get a sense of what to do insofar as reforming our healthcare system. Russell Rensburg, let me thank you for your time this afternoon. He is the director of that organisation, and of course the health minister and provincial officials are set to give us that briefing at 2 o'clock this afternoon. Once it begins, we will take you there live.